What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering how to deal with the ER emergency traumas and how to keep everyone safe while you're exposing. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years. Work a lot of day shift also, so I dabble in both worlds. So as an X-ray tech, as we all know, we hold the power of radiation since we are exposing, especially when we were doing mobile radiology on the portable exams. In the trauma room, I would say, is probably the single highest place that we have a higher chance of exposing other people outside of our department because of the traumas. For those who are not in the field or don't work in somewhere that that has like higher level traumas, I'm talking about like trauma 1, trauma 2 type of like they're probably gonna fly them out, or like any high level traumas. So essentially, let me give you a situation. So essentially, someone comes in, let's say it's a MBC, pretty bad. Most of the time they'll bring them in the stretcher, and if it's like a high level trauma, they're probably going to go to surgery, or they're going to get flown out to like a level 1 hospital. It's literally all hands on deck. Like everyone from the emergency room, regardless of what's going on, it's all hands on deck. Like all the nurses come in, like probably 1 or 2 doctors, not all the doctors, will come in, and it's like us, CAT scan, and like the surgery. Like it's a full house. Like there's barely any room to maneuver in there. So there's a lot of people that can be X-rayed. So like you and your partner, or sometimes you're just by yourself. You're there with your little board, and you're like, okay. First thing you look at is like, okay, is it a trauma board? And trauma like stretcher, and you're like, okay, it is. Check 1. Okay. If possible, place it for like a chest X-ray. Most of the time it's chest X-ray or pelvis. Depending on the situation, sometimes the doctor will be like, oh, I need a chest X-ray, or I need a pelvis. For MVCs, usually that's kind of what you go with, unless there's like obvious like punctures to like the abdomen, or like if you see the patient come in and like his femur or his leg is like bleeding and pretty messed up, then you're like, okay, he's probably gonna want to look at X-rays. Like, okay, so some of it, like before the doctor, you can already kind of in your head kind of like tell what was going on. Okay, so that happens. Let's say it's just the average chest X-ray. Okay, you place the board under, and then depending on how many nurses, respiratory, or whatever's going on, or if they're doing compressions or not, depending, you kind of have to eyeball the situation. And like you put like your little tube kind of in position where you want it. If the doctor's like, okay, I'm gonna need chest X-ray. And then depending on the severity, how many people, what's going on. There's certain people in your department that over so many traumas, over so many times, they're like, it's fine, shoot the X-ray. But you have to kind of like already know what's good, like certain, like it just takes time and rapport to kind of build that situation where you can just shoot it right away, even though there's certain people within the department. But if you've already gotten consent multiple times, but you can still, it never hurts to ask, be like, hey, we're about to shoot, does anyone need to step out? Or just like in worst case situations where it's like, hey, you just yell out X-ray, and then you yell out X-ray a few times, and then just watch people if they're like either gonna step out, or if they're still doing their nurse, their dart, whatever they're doing, and they're still doing, like as you're exposing, make sure that there's no like hands, there's no like nothing within like, that will obstruct the picture that you're taking. So you shoot it, and then usually once you shoot it, and then everyone just kind of swarms in. So like you best bet that you hope to God that everything's on there that you need, because you may not get another chance. They may get sent off to surgery, they may get flown out, they may get like, that's kind of the situation you're in, where all your experiences kind of like, it's like puts you at another level. Like it makes, I guess that's like high stake situation, I guess. It gets me excited, to be honest, those higher level traumas, because like you get to shine and show your like actual craft. I know for some of the younger ones or the students, they're like super nervous. And it is seeing so many traumas. It almost excites me just to be like looking at the student. Like if we have a student and it's like a level 1 trauma that we like, probably the first one, and just looking at them, they're like, and then you come in, you just like boom, 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 boom. Like especially if you have another partner, you just boom, 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 knocking everything out, just like flawlessly. Something like one time we had a situation where me and my partner didn't even talk at all. We already knew business. We already knew it was almost like art. It was just like just looking at each other. We just boom, 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 flawless, no communication. And like some of the nurses and doctor were like, you executed that flawlessly and you didn't say no word. And we were just like, we know what we're doing. We're certified, baby. And yeah. But anyways, getting back to the safety situation, just ask. Or if it's a real trauma, just yell out Xray and just make sure everyone steps out. Or in certain situation, respiratory, because they're bagging the patient, you may just, like if they don't have them connected to the ventilator, you just put lead on them. Or if there's someone who's stuck because they're covered in lines, ask them if they want lead, especially if they're younger. But at the end of the day, you're always supposed to ask for, like if someone's going to be there next to the patient and they're not moving because maybe they're doing something that's like life or death type situation on the patient, just be like, hey, you okay if we shoot? Sometimes they'll be like, shoot, or let me step back type of situation. Yeah, so when we go. See you on the next one.